Our most recent homeless count showed that there has been a 20% increase in the older adult population experiencing homelessness. And while for the general population, it's been a 13% increase, for women, it's been a 16% increase. So again, specifically disproportionately affecting older adult women. And just across the US, we've seen this ongoing trend of this uptick in terms of who's experiencing homelessness being over the age of 50. And in the Skid Row community in particular, about 50% of the folks experiencing homelessness, as well as 50% of the folks that we serve, are also over the age of 50. And this is particularly relevant for women because we see that women experiencing homelessness are aging approximately 20 years faster than their housed counterparts. And in terms of the most contributing factor to homelessness, it's really about income inequities, and women over the age of 65 are experiencing poverty rates, or women of color over the age of 65 are experiencing poverty rates that are almost double that of white women. And then women of color also have about 1/10 of the assets of white women. And, you know, there's lots of factors that contribute to income inequity, but again, we know that people of color are disproportionately impacted, with Latina women being the lowest earning demographics at about 47% of what's earned by white men. And then just general gender discrimination and women's vulnerability to age discrimination in employment. Women are also the most likely to be caregivers, and this can result in gaps in employment, fewer years in which to build resumes, fewer years in which to build assets or pensions. And women with children earn about 28 times less than women without children. So really significant, and also, you know, really important work, but not appropriately compensated. Also, among folks experiencing homelessness, you heard a little bit about the social determinants of health, and these really correlate to the factors that cause homelessness. So we're starting from a place of you know, folks experiencing these multifaceted factors that both contribute to their homelessness and then also contribute to their adverse outcomes later in life. And then also really of note is that women experiencing homelessness actually have shorter life expectancies than men. So in the general housed population, we know that women typically live to be about 83 years and housed men is about 79 years, compared to the life expectancies of women who've experienced homelessness being at about 48 years compared to 51 years for men experiencing homelessness. So again, the experience of being unsheltered really takes a physical toll. Also less likely to be able to carry out their activities of daily living. And also, we also see that women who are about 45 years or older pay 27.5% more for health expenses compared to male counterparts. Folks experiencing homelessness were in the top 3 prioritization for risk, but being in the top 3 meant not getting proper PPE and resources at the same rate as like hospitals and first responders, for example. The increase in food insecurity for folks who were already experiencing food insecurity, inability to go to food pantries and places where you know, the normal food would have been obtained. Again, disproportionate job loss for women in service industry types of jobs. And then those with jobs are often frontline workers who could not work remotely. And then the limited capacity to practice social distancing, physical distancing. And so in response to this, the homeless services sector focused on what some folks may have heard of, a project called Project Room Key, which was created to house the folks who were most vulnerable to loss of life if they contracted COVID. And the eligibility criteria for this was based on being age 65 or older or having a pre-existing condition. So it really started as a way to decompress shelters and congregate living situations to help increase physical distancing. And it progressively opened up to other folks who were generally unsheltered. And it consisted of homeless service providers taking over the operations of hotels, providing 24-hour staffing, meals, on-site nurses, doctors, health, mental health, and case management. And it was made available initially for 90 days through FEMA funding, but as the clock has been ticking down, the pressure is really on to house the folks that are in room key. So, that's really the focus of the homeless services sector, recognizing that this most vulnerable population is going to, not have this resource imminently.